Hello, everybody. It is Tuesday night. Welcome to the Dr. Boz live show. We do have a great show for you tonight. I just checked numbers a little too early, actually. I usually do it live in front of you. I have been on the best fast that I've been on since Christmas. I did miss you with a couple of weeks in there, and that ketone of 3.0 and glucose of 72, and woo, can I feel it? I do feel really good. Tonight I am drinking a bit of the Keto BHB, and I will tell you that this is going on sale. I would look for any place. I think Amazon's going to have your best sale price for it because it expires in 6 months, and I have to get through that. So I've put it on a pretty steep discount. I think it's 25% off, and we are looking forward to replenishing that. You will hardly find that kind of a discount any other way. I am going to start right off by showing you why I did that thumbnail. The criminal acts that, well, let me have this video speak for itself.
I agree, and I feel like headlines of that sort, which have come up recently around various dietary interventions, we won't go there, at least not for the time being, are nothing short of criminal because they really distort people's thinking, but also they steer the course of science and medicine for, as you pointed out, for decades, if not longer. And
Yes, so if you are a man, I want you to stay tuned in. We are going to have a discussion here that, well, I've had probably thousands of times behind the exam room door, but I have not done on YouTube before. And I have to thank these two men who brought this topic to a much easier place for me to talk about publicly than it was when I first entered practice, which was in 1998 when I graduated from residency or from medical school and started residency. That's where you're diving into literature. Everything you say has to be cited if you've got good professors teaching you. And I sure did at the University of Utah, had some really great attention to how do you take evidence and apply it to people? And how do you do it without hurting them? And how do you do it without blunting what you are going to have to learn as a physician, which is where does medicine meet value and benefit for our patients? As I look at different topics for people to talk about, it was actually the guy on our team who brought this forward. So you men out there who have women that you love, stay tuned. This is a really important topic that is not typical for what I do on this channel, but I do think you'll see why I'm so passionate about this by the end of the show. So let's hop over to the rest of these. I am watching the chat off to the side, so thank you for doing that. I'm looking at where folks are from. Please keep putting that in there. We are going to have some good questions from tonight, so be putting your questions in. My team is watching that, and we will reward those of you that are showing up live on the show and putting your questions in. You'll also notice that when you're here live, there are no commercials. I am interested in hearing from you and doing everything I can to make this accessible. Let's go over this graph. If you ever needed evidence that women are more complicated than men, this might be it. These 4 lines show the pathway or the amount of hormones following 4 different tracks of these hormones for a woman who's privileged during the years where she can reproduce. This is what she is lucky enough to experience, is the zigzag up, down, inside out of hormones. So let's start over here at day 0. Day 0 is the first day of her period. So she starts to bleed on day 1, and you'll notice all 4 of these lines are pretty stable at what we call the nadir, the baseline, which is where they hang out. And then you'll see that estrogen takes the lead with a rise in estrogen. And that is saying, yep, can we make a baby? The pituitary gland weighs in with a rise in luteinizing hormone and follicular stimulating hormone, which really means, hey, ovaries, let go of one of your eggs. It'll float down the fallopian tube. And if it runs into a sperm, then we get to have life. There is a really important hormone that in Latin means to promote the gestation. To gestate, that verb means to grow a baby. to form another human. To promote the gestation of that is progesterone. And that's where you'll see this rise in progesterone go up. And if they're lucky enough to have a sperm meeting egg, you will see this keep going way up. In fact, if you do a pregnancy test, what they're checking for in the urine is the spillover of this high amount of promoting the gestation, progesterone. But if they do not have the blessing of having a baby, well, then that progesterone drops. And if you've ever had a time where a woman is not the easiest person to deal with and her mood might be a bit irritable, it was probably when this plummet, this drop in progesterone was happening to her. And well, that's PMS. That's what happens to PMS. That's what it looks like. So as we compare, I think this is a fantastic graph that if I took that same woman and I said, all right, let's plot out that progesterone, the estrogen, the LH, the FSH, what's her testosterone? Because women don't talk about that very much, but her testosterone level, well, it's 5 to 10 times higher than her estrogen. So yes, it is a big part of the picture of women's hormones. It is one of the fat-based hormones that's in this graph. It is not ignored, but we're not going to focus on that right now. We're going to talk more about, well, these squiggly lines and this complex woman that we're dealing with. Because if a woman comes and says, you know, doc, I want to hold off having babies for a while, and we know that if I want to protect those ova, those eggs that could become a baby, that we would keep them in their ovaries, and we would not have a lot of wiggling around in her hormones. In other words, if she was pregnant, the ovaries would be dormant. The aging process of those eggs is muted. It's much less damaging to the DNA inside those eggs, so we would hold it stable. And when we put them on birth control, what we are really trying to do is prevent that spike, because the spike is when they release an egg. We want that flat. So how do we do that? Well, we give them estrogen and progesterone. That's called birth control. And as long as they take their pill every day for 30 days, that's going to stay the same. If they take placebo, well, then the estrogen and progesterone go down and they have a period. But it's not enough time to stimulate that FSH and LH before they go back on the pill 7 days later. That's what birth control looks like. We have a very, similar process that, not similar, it's actually opposite of what happens when a woman goes through menopause. When her estrogen and progesterone go to 0, her FSH and LH shoot up to the highest level, above 100. During that previous graph, that FSLHA are in the teens or in the single digits. They're at their nadir, at their baseline. And only during a moment of hormesis does that happen. Now, I know this is a lesson that many of you weren't planning on, but it is really important when it comes to what do we do with hormone replacement therapy. When I put a woman on hormone replacement therapy, what I'm looking for is that her FSH and her LH go back down to not being noisy, that it's not being loud. So I need to make sure I replace it to a level that gives that benefit. These are just some of the basic beginning conversations, but they're going to help you because as I entered practice in 2001 and had just come from the highest didactic season of my education, I knew that HRT decreased the risk of heart disease, increased bone health, decreased the risk of fractures, had better energy, and better sexual health. And in a minute, I'm going to show you the evidence behind how I knew that. So the question that I'm posing for tonight and for folks that are watching this on the replay is, why? Why don't doctors want to prescribe this? Well, that's the criminal part. That's the part that Dr. Huberman and Dr. Attia were talking about at the beginning, saying, if there is one crime that I have had to hide behind an exam room door, saying, that's not what this literature says. That's not what this literature says. And then you're in front of the women who, well, let's move on. It is headlines like this. And I'd like you to take notice that this headline came out in 2002. I'm a baby doctor No, I didn't take care of babies. I was just barely into private practice, out on my own, trying to answer the real questions of where the practice of medicine was happening. It was a time where all of my education, all of that study was now being applied. And by golly, I had a couple of years, 3 years probably, of writing the prescriptions for hormone replacement therapy, watching what happened to women when they went without it, looking at the disaster that happens in many parts of their body, the quick aging that is known for what happens when a woman's estrogen plummets. Here's what the headline read in this study. Researchers abruptly halted a prevention trial of estrogen progesterone, take notice of this word, in healthy menopausal women after an independent monitoring committee found 26% increase in invasive breast cancer. These were the people who, a 20% increase in the people who took the hormones. And of course, if you're going to have a 26% increase in cancer, well, my goodness, that gets my attention. That should get your attention. And you would stop hormones, for heaven's sakes. Who cares that your brain is going to go into haywire if you are a multitasking woman like yours truly, and you have said, I don't understand how men can't think about 4 things at once. Well, you will soon without that estrogen. It is a different woman's brain. That was the most powerful thing that I learned in the years of, okay, what happens to her brain without estrogen? And as I would say, here's what the study said. Yes, the cases of breast cancer in this randomized, double-blinded, placebo-controlled trial, 6,000 patients, the most costly randomized controlled trial the government had ever led and paid for. And there were 30 cases of the women in that trial, those healthy women, postmenopausal women who didn't take hormone replacement therapy, 30 of them got invasive breast cancer. Whereas 38 of the women who took the hormones got cancer. And by golly, that is a 26% increase. My goodness, we should stop these hormones, stop causing the breast cancer in these women. But what Dr. Huberman and Dr. Attia and I continue to remind, well, anybody who's been trained in interpreting information in the application of medicine is do not ever talk about relative risk without showing what the absolute risk is at the same time. Because let's take a look at relative risk. Relative risk means that here is the impact that it had. And if that relative risk is less than 1, well, then that might be protective. But if the relative risk is greater than 1, well, then that might have a causative effect. So let's take a look at a graph. The relative risk for breast cancer. This is breast cancer data. If you had dietary fiber, boy, that was protective. So was weight gain from 21%. Having garlic and onions, high stress level, that's protective. Oh boy, grapefruit might be protective. So would fish oil. And then if they had a large body when they started their period, if they took an aspirin, if they had coffee, 5 cups a day, average weight at the age of 12, which might be the same as this one. And when you look, here's where the numbers started to turn red. So now we have, well, that fish intake, unlike fish oil, was now had a relative risk increase. So was a birth at size of greater than 20 inches, their birth length of greater than 20 inches. Exposure to light at night, I'll go back to my red here. Here's that Premarin with progestin in it, that progestating hormone in it. And here's Premarin again. This was 2002 data, 2003 data. They extended it a year. And 2002 was a higher risk, relative risk for breast cancer than the following year. Yeah, they run it a year longer, and that risk wasn't as statistically high. Alcohol increased the risk, so did French fries. Now we've got grapefruit again, which is causing danger. And if you remember on the graph a few seconds ago, it was not causing danger. And the numbers continue to talk here. If you happen to know your placental weight, I don't know what the heck, antibiotic use for more than 1,000 days, well, that was significantly higher. And if you look at an increased carbohydrate intake, we had a 2.2. If you had left-handedness when you were premenopausal, as if somehow Postmenopausal, they changed their left-handedness. And if you want to see a 26% increase in risk, a 26% increase in relative risk, that is tobacco smoking and lung cancer. The relative risk, if you were a tobacco user and you had lung cancer, there was a 26 relative risk. There's 26 risk of having that breast cancer be invasive. I'm going to warn you right now that there is a huge storm happening here in Tampa, and we've already had the power go out a couple times, so I'm praying that doesn't happen here. But stay tuned because this story gets even better. All right, so let's go back. 26% risk, relative risk of the control versus the breast cancer, 30 versus 38. When you take that to an absolute risk, it was a 0.08% increased risk. 30 in 10,000 versus 38 in 10,000 breast cancers. And that's where these headlines came from. And well, that WHI, when they said we have healthy patients. Okay, what did that mean? Well, first of all, the average age of the people they started the hormone replacement therapy on, they were not 52 like I am. They were 10 years after menopause, 10 years of no hormones. There was 70% of them were overweight or obese. I think it was 50% of them actually were in the obese section. That over half of them were smokers or past smokers. And there was about 1/3 of them had high blood pressure. So I don't know about your definition of healthy, but that would not be my definition. Even in 2001, 2002 when this came out, that is not the definition of healthy. As you look at the benefits of HRT, what I entered this discussion with was a decreased risk of heart disease, a decreased risk of bone health, a decreased risk of fractures specifically, better energy, better side. This part was very easy. I'm going to show you where that data comes from in just a minute. This discussion, the first time I said this out loud, outside of my exam room, was when actually it was in the last 21 day. Someone asked me the question about what should they do about hormone replacement therapy at the age they were at. And I did the default thing that I hadn't done outside of the exam room in years. I mean, outside of medical students, I don't think I'd ever said it outside the exam room. The data, the file that I kept to say, here's where the evidence comes from. This is how I'm making this decision. Really expecting that at some point, there was going to be a lawsuit. Like, why am I putting people on a hormone replacement therapy when this WHI trial said there was a 26% increase in invasive breast cancer? There were even women who had cancer that I had gone through very carefully as their physician with that doctor-patient relationship, and we concluded the right answer at this stage of their life was to put them back on estrogen replacement therapy. And yeah, that was, I mean, for sure, that I kept that file to say, here's where the data comes from. I felt like I was the only one talking about it. But here's what happens next. I'm going to start by showing you one of my favorite places to teach from, which was the growth of osteoporosis. This data was the easiest to get my head around. It was also the easiest discussion because you see how long this has taken for me to have this discussion with you. Yeah, I didn't get slides back then. I was trying to convince a woman who was scared to death that estrogen had anything healthy to do with her, and the headlines were winning. But what I did know is that osteoporosis is a process where, if you'll notice, this one is normal, this one is osteopenia, and this one's osteoporosis. So the disease is the health of the bone is getting worse as this progresses. But what I want you to specifically take note of is look at how this interwovenness of the bone is being, well, it's like it's sponging out. It's moth-eaten. as it goes forward. And there is something called a tensile strength to bones that we know that a bone should be able to give and bend. That ability to give and bend, how far can you bend it before it snaps, is a tensile strength. And when a woman enters menopause, we know that, well, her estrogen changes dramatically, and she will first sacrifice the sponge inside. And when I was struggling with this as a brand new doctor, the data for how to keep bones healthy or how to restore bones healthy, first of all, nothing did it better than estrogen, especially if they were within 6 years of that menopause. That menopause, we could add that estrogen back on, and we could stop that bone loss. There are drugs like Fosamax and other drugs that, well, they changed the outside or that cortical strength, but the tensile strength became more brittle. So when the woman was standing there waiting for the bus, this actually was one of my patients, and she says, "Doc, it was the strangest thing. I was standing there. I had no pain, but suddenly I was on the ground. No, I did not fall off the curb. No, I did not fall out of the bus. I was just standing there. And it actually wasn't a lot of pain, but I could not stand up." And what had happened was that her hip broke right there. It broke right there. And why did it break? Because this part had been whittled away. She was 12 years from her last drop of estrogen. We know that if you waited if we had kept her on estrogen for 10 years, and then we stopped estrogen, we know that the bones will decline to the strength they would have had she never been on it. So as soon as we stopped the estrogen, her bones would deteriorate. Now, but that wasn't the only benefit. As I would hear from many patients, this was their fear, that heart disease is an old woman's disease. But it's, "Doc, I don't want to die young. Breast cancer is what will kill me. I need to not die of breast cancer. So I'm going to stop my hormones and not take any hormones as I age." And I will tell you, here's some statistics that you should put your head around. First of all, heart disease versus breast cancer versus our breast cancer. 25% of women die of heart disease. It is still the number one leading cause of death for women is cardiovascular disease. What is the risk of death for women of breast cancer? Praise God, it is only 2.6%. Now that is something women don't hear. When I would show them this, they would not believe me. I would have to get the papers out to show them. The lifetime risk of heart disease is 56%. The lifetime risk of breast cancer is 1 in 8. We hear that statistic all the time. And women think, yeah, it's 1 in 8, but it's 1 in 2 of you will get heart disease. So why was the discussion muted, shut off? It was criminal what was done to women. And as a physician trying to say, I can't be the only one who sees this. But it was impossible. It was like, if there's a way to get cancel cultured in 2001, it was talking about something positive that estrogen was doing. 64% of women who die from heart disease, their first symptom is sudden cardiac death. Unlike men, they have a different presentation. And even men, 50% of their first presentation of this cardiovascular disease is a funeral. They get nothing. They get no warning, chest pain, nothing. No, they die. The most astute person in understanding what heart disease looks like, well, it's the pathologist, the guy who's doing the autopsies. All right, hang in there. I'm not done yet. So this was one of the best articles that says the uncertainty about postmenopausal estrogen. I will put a link to this article in you can Google it though, New England Journal of Medicine. This is the first time where I remember people starting to talk about, hey, it's time for action, quit debating this. There is a 40 to 50% decrease in the risk of heart disease when women took hormone replacement therapy. So these two men have done a great job of, well, leading the way, having the discussion about the women in their lives that, well, it's not easy. When Peter Attia is from Canada, so he flew home to be with his mother, to go to her doctor to say, hey, she does not have to go off of her hormones just because she's going through menopause. And he said the doctor looked at me like I had two heads. He was well informed. He understood the statistics and what my folder is filled with to say, what would I say if I'm the one who's licensed to advise them about their health? So not only do I want to say, praise be to God that more men need to be like Dr. Huerman and Dr. Attia, that says they're informed and they help their women make this decision. Because it isn't fair to watch some of the advice that's out there. So the question is, I'm 52. I am still a cycling woman, praise Jesus. I'm thankful for that. But I know that, oh yeah, my days are numbered. My days are numbered. So here, this is a population study for the average amount of estrogen produced by a 20-year-old, a 30-year-old, a 40-year-old. Okay, so here's me at 52. But this is what a population study looks like. So that the estrogen is pretty high throughout their life, and then, well, it declines. And that promoting the, or that LH, the FSH, I'm sorry, I said the wrong one again. Well, that one your brain will notice the moment you're not making enough. But this is a population study. And if I had to draw out what would it look like for the men, their testosterone, well, the men, as a population study, they do this nice, gradual, slowly over time, decrease their testosterone. So it's not like it's not expected with age, but this transition, that postmenopausal life, well, here's what it looks like when you when you look at it within one person, that they are going along fine, life is lovely, no problem, and then it stops. And they go through a transition that usually is within 6 months. They stop making estrogen, and their brain says, what have you done? But their heart does something as well, and so does their bones. Let's set aside the energy that comes with bodies that are filled with estrogen versus those that aren't. The women who are my people, the ones who do not sit still well. So the question is, who should take hormone replacement therapy and who shouldn't? Okay, so I do like being on YouTube. I do not want to be canceled. I am here to tell you that the answer isn't perfect, but it is very well documented. I'm going to show you. I'm going to show you this. So let's go to table of contents here. First of all, I want to show you a book. Now the book, I really want to do something that is, you can call me, well, I don't know what you would call me. I came across this book. It was written a couple years ago. Here we go. And it is called Estrogen Matters. You will find in the show notes below, and I think I can copy and paste it into the chat right here. Let's go here. I really want you to copy the link. The link says, I sent you. I sent this, let's see if I can do it. I'm just having a tough time copying and pasting here. I'm also noticing that the storm is really bad out there. Okay, so I'm putting it in the show notes here, or in the chat as well. And I think if somebody can pin that to the top. Anyway, that is the link. Because if you go by that, they're going to say Dr. Bosworth sent you. It's just a way for one author to promote another author. It was produced a couple of years ago. The audiobook was something that I listened to over the weekend, and probably, I think I listened to it like 3 times because I was like, I was comforted. I was comforted that the stuff that I'd been telling patients for years, somebody else said out loud. Like, how is it that I arrive on the scene of medicine in the best stage of my career, understanding, testing for how do you be a great doctor? That's what that was all about. let's go to the bookmarks that I put aside. I'm going to go to this page and say, does estrogen cause breast cancer? And you'll instantly see, what do you mean? Yes, it does. No, it doesn't. How is that possible? So I think if I touch here, go here, and then I go to the next highlight, I'm going to go to this epidemiology. So in 1986, a study shows that there was no statistical significant increase in risk of breast cancer among women on Premarin. So this came out, before. This was the stuff I was studying. This is part of the list that was in my book, or in my folder. In 1998, a meta-analysis of 22 studies said that, yes, there is no statistical association between estrogen replacement therapy and new onset breast cancer. In 1991, another one said that there was no increased risk of breast cancer in Premarin users after 15 years of use. In 1991, there was no association between estrogen and breast cancer. 1992, again, this was great. After more than 2 decades, there was an 11.5% increase in women taking the placebo that they had developed breast cancer, but none of the women taking HRT had. This was the literature that I had been studying before I got to private practice, and God forbid, I felt like I'd lost my mind. Like, where did my education go? How is everybody jumping off the bandwagon for this study? That, well, when you get to the statistics of it, there were parts of it that they were touting that, well, the headline that I love that talks about in this book, and if you are looking, I am not going to be able to answer all of your questions on this. I'm going to take your questions. I'm going to do my best to answer your questions. This is really important for me to get to have something that I've kept behind the exam room door. This is what I tell patients, but I sure as heck don't put it on YouTube, because I don't like the hate comments either. But it certainly should be talked about. And it was definitely what I told my mother. And it was clearly when a patient really wanted to, if they had a passion and said, I have read the articles, there's nothing I can do about this, I am not going to go on your Premarin, your mare's urine, okay, fine. But if I would try to say, here's what you're going to sacrifice, here's what's going to go wrong with your heart in the next several years, here's what the study, again, 10 years after they'd gone through menopause, these women were not healthy. Half of them were smokers. 70% of them were overweight. High blood pressure was in a third of them. And there was clearly going to be calcifications and plaques within their coronary arteries when they went on the estrogen. This was not a healthy population of people trying to prevent the progression of heart disease. They already had heart disease. All right, so as you can see, I think this is criminal. I think this was one of the biggest mistakes made in medicine. And it isn't without pause that I said, do I dare say this on YouTube? Do I dare show people what it is that I get passionate about? Not just once or twice in a lifetime have I gone through this. I clearly have been one of the many closeted physicians who say, dang, it is not a good place to be, but what I mean is alone, alone and quietly saying, hey, there's more to this estrogen thing than you think there is. Yes, I don't want breast cancer more than anyone, but that's not your biggest worry here. And as I look at the place where I was brave enough to say this out loud, it was the 21-day metabolic kick where I want to show you a couple things of announcements, and then I'm going to get to your questions. I know you've got some good ones there that, yeah, I hope I can answer. Let's go to those. There we go. So I do want to point out there are a couple things that we are going to be adding to our website, but the most important one is that the Metabolic Health Summit is coming up this month in my little backyard here in Clearwater is where it's held, but that's right around the corner from Tampa. And that's another place where I just can't tell the folks who lead this thank you enough. I hope you use the link because you get a little discount on it, but mostly I hope you give them support. It was 2015 when this story of mine, much like the breast cancer story, started. And that was, I was helping my mother with something that was disastrous. It was awful. And a ketogenic diet did way more than I ever expected it to do. That when a ketogenic diet was so profoundly impacting her health, her longevity, way better than any of the medicines I was writing her. And as those of you that know, the Any Way You Can is the story of what happened. I lost a bet with my husband. He said, "You should put that into a book. You should put that into a book." And I was maybe a little premenopausal. No, I wasn't actually. But I was like, I don't want to do that. I'm not a writer. That's not what I do. And I lost the bet, and I wrote the book, and over 300,000 copies have been sold. It is self-published, and it is a testimony that says when you are bravely going to say out loud the things that you're seeing in your clinical practice. And the way I got brave enough to do it was this Metabolic Health Summit in 2015 here in Tampa. First time I'd ever been to Tampa, at the University of South Florida. Dom D'Agostino and his band of researchers that were curious, they led a conference that, well, I measure all other conferences to this one. It is bench scientists showing what is the research on the front lines, what can we expect answers to in the future, how can I possibly talk about some of the things that they are not found in any textbook. And although it's much more discussed now, it was not at all discussed in 2015. And I found my people. I found the people who were curious about why mitochondrial health was so important but not talked about at all. And why in the heck is a ketone making it so much better? And it took a lot of self-study. It's a good thing I'm stubborn. But most importantly, it was the people at the Metabolic Health Summit that comforted me out of the closeted moment in my exam rooms where I'm saying, well, here's what I told my mom to do. Here's what I'm doing with my mom. And that sounds like so anecdotal. That's not the evidence-based medicine. That wasn't but it was clinical medicine, which is the same mistake that I see happening, that did happen with breast cancer and estrogen, that the numbers aren't adding up. And when you listen to the book, there is a fantastic quote that I can remember. Well, the whispers, the people that were like me, I found a few of them. And when we would whisper in the hallway about, did you see the headline about the part where he said, the statisticians need to leave the room because this is the most money we've ever spent. We will never get this large of a randomized controlled trial for estrogen. So you statisticians just need to leave the room. This is as close as we're going to get. And there is 25 years of women who have had to go without estrogen after menopause. They have had to be the mammal on earth who says, yes, our years of reproducing are lower, but our brains are about to be sacrificed. Our bones are about to melt from the inside out. And the heart disease is about to match that of men because estrogen is taboo for something that statistically was not true. And the passion I have about telling you that is, it is 20 years of bottled up. How is no one talking about this? And I actually am a little embarrassed that this book came out and I missed it. It was released right around COVID and I missed it. And I want to give my patrons to the authors to this book. And I want the men and the women out there who want to know about estrogen to read the book. This is a YouTube channel. I cannot give you medical advice. I can educate you, I can point you towards the education, and I can reward people for being owners of their own health, which is the only way I would do it today. It is not like you guys are any smarter than me. You can read, you can see conclusions. This is not this closeted place where the Bible's in Greek and we aren't going to translate it for the people that want to know about it. This is published data, and this book lays it out so beautifully, cited and delivered in a way that is enjoyable to listen to the book, but is also well researched. So let me do one more announcement, and then we will get to your questions, which look like they are definitely adding up. So let me click here and here. I wanted to show one more thing here. I have a few things that I'm going to be adding to, where did that go? Website. There we go. That I'm going to be adding to this page. I wanted to point out this one. MitoPure is one of these, well, it's a supplement that I have been an affiliate for probably 2.5 years, and it's because it took me that long to get through their literature. They have, so I have recently put this on my page. I have been taking it on and off, but as I have been trying to help my son, who is in his last semester, senior year, wrestling his way out of a back injury and or just a back that's got a muscle strain. And I said, well, what are the things that I'm doing besides ketosis to get him to heal? I have a video, but probably won't come out for a couple months, on why this supplement is something I take and something I will have him take when he's repairing from an injury. And he's young. So be sure to scroll all the way through these. I have some updates that are coming to you over the next few months. And I just, if you always stop at the Dr. Boz favorites page, you're going to know what my endorsements are. Again, anytime you use one of those links, it connects to funding and helping our channel stay as free as we can make it. The other big announcement on our page is two things. Number one, the Masterclass is going on right now in the Dr. Boz. We had our first one today. We have another one in 2 days. And then a week from today, we have the final one. This is what I learned trying to find people who, well, that they're nerdy enough to want to join the 21-day metabolic kick. That this is, when I moved to Florida, I was expecting to open my doors and have things flow, well, like I wanted. But God had a different plan, and the brakes got put on, and I have a medical license. I have malpractice. But there have been a few steps that have really blunted my ability to serve the people that I feel called to serve, and that's you. So I'm doing as many things as I can to keep free. My Pin Chasers meeting, my free support room at Tuesday mornings at 8 o'clock. Oh my gosh, there must have been 50 people there today. Somebody came from the Philippines. Do not do that. They were here and they joined the meeting, but maybe they came because of me. But that's a lot. Don't do that. It's only one meeting, but they were great. Honestly, we got a picture taken together. I should have prepared that and had it ready to show you, but it was really a blessing to see them. And what I look at is the two places that I really do keep the team funded and the clinic having a hope of being what I think translational medicine could be, where my job is to be the teacher and to then teach to you, the masses, while still paying the nurse, paying the bills. And that has to do with, right now, the closest you can get to my clinic is the 21-day metabolic kick. We will open that cart in I think it's about a week and a half. We only keep it open until the 200 slots are filled, and then we close it. So being on the email list is really important if you want to be part of that class. Being part of the Masterclass, we open the cart in a week. That's at the end of the Masterclass, we open the cart. That if the beginner's class is all you need, and that's the stage of life you're at, great. But if not, what I would have my mother do, living in rural South Dakota, needing a support group, needing the example of how to live outside of the box, outside of the lane in medicine today, that's what happens in the 21-day metabolic kick. This estrogen talk, well, that happened inside the 21-day. There are 10 cases where I give personalized understanding of what would I do if you were in my clinic. And it's under that educational platform that I feel like I'm doing my best work, that it fuels a lot of these discussions for Tuesday night, what comes out of that 21-day. It's intense. And, over the past week, I've had a slump of just, actually, as I'm studying menopause, I thought, oh, dang, if this is what menopause feels like, I'm in real trouble. But I think I was just down after the holidays, and my son had left back to college, and the other kids, 5 days of work, everybody's back to school. Life is back, right? And my husband noticed first, and he said, yeah, honey, you got to slow down. You got to cut some stuff out. And I'm like, what would I cut? And he goes, well, what wouldn't you cut? And the first thing that came up is I would not cut my Tuesday morning support group. That is really important. And I would not cut the 21-day metabolic kick because it is doing more medicine, more impact than I think I've ever done. And at the Metabolic Health Summit, there's a poster contest, and our poster presents the data of change that happens in 21 days. So if you are going to be there, please come see me. Please come meet the interns. They're all going to get to go to the conference. And be sure to use that affiliate link or the Dr. Boz promo code, because it really does show them. I don't get any kickback for it. I don't want any kickback for it. I want to support them. But it shows them that I'm sending people to them. And that's, well, good for me, good for them. All right, let's get to your questions. Okay, I know I took a little longer there than I thought. Hold on here. So here we have Anne, who says, I've been learning for you and I am insulin resistant with weight still to lose, ballpark about 50 pounds. Oopsie daisy, I need to look what I'm doing here. There we go. Ballpark about 50 pounds. Does increased insulin affect hormones, especially the closer I get to menopause? You know, that's a good question. Let me show you this, this graph, because what I think is dangerous is, check this out. Okay, so this is the population study of what happens to estrogen as you age, right? And, you know, somewhere in there it plummets. But remember that individual study where it dropped suddenly? When you look at the increase in insulin, it has insulin. I gotta think about what I'm doing there. It has a message to these fat-based hormones. One of those fat-based hormones is estrogen. And insulin is the dictator. It is the holy grail. It is going to tell these fat-based molecules what to do. And when insulin is high, it pushes them into storage. And what happens to these women in their 40s as they carry the weight is they go through menopause earlier. And honestly, when they get a colonoscopy, or they stop eating for 2 days, or they go on a ketogenic diet, let me do that in red. The estrogen drops when their insulin is high, and then when they fast, or they go on a ketogenic diet and then fast, the estrogen bounces right back up. So what I see women doing is sputtering. And you know that part where the progesterone drops and she was in a moody PMS mood? That's what's happening to these women until their ovaries give out, and then they often go into menopause much earlier. When I look at some of the most powerful messages that I think are missed by women, it's that if you want to delay estrogen removal as long as possible naturally, you should be in a therapeutic ketogenic state. You should be in a therapeutic ketogenic state unless there's any reason, which I don't know if I could think of one, to not be in a therapeutic state. That protects your estrogen to get to its end organ, to get to your brain and your ovaries. So I'm just make sure I got the question answered, because I can sometimes get off on a tangent and I've been scolded by that. So insulin resistant with weight to lose. Does increased insulin affect hormone, especially? Yeah, so it does affect the hormones. They sputter through menopause. It's the most miserable version of menopause I've ever seen, because they go on and off. And they get to be told what it's like to be back on it, and then they get off. And then they get told what to be back on and off. And unfortunately, like many, they were too scared to be on insulin. Laura writes in and says, hello from Vancouver. Nice to see you. Thank you for coming. Hoping to find out if a 71-year-old at 71 years old, that I have to stay on bioidentical hormones forever, currently carnivore and fasting. So if you're 71 and you're on bioidentical hormones, why would you stop? I'm being serious. What's pushing you to stop? Just because you don't like taking them? And you can stop it. This is where the next major thing that happened in my career was, okay, fine. So the WHI comes out and the estrogen replacement is everybody gets scared off of it, but some people stayed on it. And then we had to say, well, how long should they be on it? And this arbitrary number of a decade. 10 years. 10 years is what you should be on estrogen. Where's the evidence behind 10 years? It isn't any. It's two people in a room arguing, debating, and it was like the consolation prize for saying, yes, we'll say to everybody that estrogen is this horrible thing, as long as you give us the ability to have the guidelines say that we can keep them on it for 10 years. So at 10 years, now you can make their bones osteoporotic. Now you can rapidly advance their heart disease. Now you can take their brain offline and induce a mood storm that I think is horrible to watch. And God, it made me never want to grow old when I was helping patients with it. Like, damn, if this is what it means, I'm definitely in trouble. So my question for real is, why would you want to stop it? So Sam, is it ever too late to start? So I'll tell you the committees, and this book will go through this really well. In fact, let me go here because I can show you. This question is asked in the book, and I thought, oh God, I'm so glad they addressed it. So go here, go to my highlights, and go to here. So go to, oops, that's not the one I wanted. Go to, oh, that's not the one I want either. There, that's the one I want. Okay, so this is at the end of the book, Estrogen Matters, and it's the reflections from the physician. So it's written by a psychologist who actually deals with the psychology of change. And I had seen some of her stuff before, but I had no idea she was this author. So it says right there, I didn't take hormones when I entered menopause. Can I start HRT in my 60s? And the author goes on to talk about how, I think there might be another place where it doesn't cut off here. So, who begin HRT during menopause for symptoms that serious effect, so that he hedges here. But HRT, here's the most important thing that I agree with this. It is not something that you can start and stop every few years. So the question is, what do you do now? And I think this is where I get really angry that, yeah, they did this awful advice for physicians and women. And unfortunately, now what? Now that the truth is coming out, how do you handle somebody who says, but I stopped it because of this fear? Well, what do I do now? And again, this is not a place for you to get medical advice. It's a place for you to get educated and curious and to chase the answers. Get the book, take the book into your doctor. It has every one of the studies cited. It's like they stole my little folder and put it in a book. It's really that good. So is it too late to start estrogen? You know, it's tough because if there was one thing we learned from the WHO trial, the Women's Health Initiatives trial, WHI trial, it's that when women have heart disease, when they have hardening of the arteries, and then you start them on estrogen, yeah, there are some things we have to watch for, especially the first year. And so I would answer that inside the 21-day metabolic course, but my lawyer would kill me if I answered that here. So read the book, take it to your doctor. That's the answer. That's the formal answer. My lawyer will not call me tomorrow. Let's go to questions again. So Joyce writes in and says, my mom's breast cancer was estrogen and progesterone receptive, and I was told I should never take HRT. This is confusing. Yes, there is a whole chapter on, let me go back to this, on breast cancer and the discussions that should have happened over 20 years ago, but didn't. Let me go back in here and go to the table of contents. So I'll show you what I'm doing here. I think it's, oh, that's not it. Yeah, so here is the table of contents, and can breast cancer survivors take estrogen? That's one. And does estrogen cause breast cancer? That it's in this chapter that, oh no, actually it was that was the other chapter. I'm just trying to show you where to find it in the book. Oh, that's not what I wanted. Hold tight, don't run away. That's not it. Hold on, don't run away. Table of contents. So it was this one. Yeah, can breast cancer, this was one of my favorites because I had an oncologist who was, on my speed dial. She went to residency with me, went on to fellowship in oncology. And the process of seeing that, well, you get that as we age, there is less estrogen around. And the aging process promoted more cancers, but there wasn't as much estrogen around. So why are we saying that estrogen was the cause of this? And in some of the most invasive cancers, the best treatment for these cancers was a whole bunch of estrogen. Now, this isn't something that they talked about a lot, but when it's your patient and you're saying, you're doing what? You're pouring estrogen into her? Why? And then the cancer disappeared. You're like, oh my goodness. And it takes you right back to physiology saying, why? Yeah, I need to study this better. I need to understand this. And if you read through this, well, he must have had the exact same, he talks about, I was an oncologist before there was a specialty named after it. Anyway, he talks about this exact question. And I'm going to push you to the book to read it because then I don't get in trouble. I don't give you medical advice. But it's not a default answer. It's not like, oh my goodness, your mother had breast cancer. You should never take estrogen. That's not that simple of an answer. That's what has me so angry. That's what had these two physicians, one a physician, one a PhD, amazing educators, people who study the literature, just ticked that they arrived at the answer. And by golly, it was not as easy as it should have been. It's hard. It deserves attention and struggle and time. So let's keep going here because there's some other really good questions. If you have hot flashes, is it due to estrogen? How does that relate to the need for HRT? So yeah, one of the highest symptoms of the removal of estrogen, oopsie, that's not what I wanted, of the removal of estrogen is they get hot flashes. They get vasomotor. The arteries quiver. And so that causes them to just pour sweat at night, during the day, boom, they don't get awareness. They just get a whole bunch of hot flashes. You want to see that reverse? Add estrogen. Somebody in the support group today at the Pin Chasers, we were talking about this subject and how I was a little nervous to have a discussion that doesn't have anything to do with ketones, but is something super important to me. And she's like, well, what if I just took DHEA over the counter? And I'm like, here's the truth. If the estrogen improves their I'm going to show you this. If estrogen improves their symptoms, guess what? Guess what their watch this. Okay, hold on. No, not that one. Go to this one. Yeah, here's menopause, right? Notice that the FSH and LH are high. When I give a woman enough estrogen that it calms down her brain, the pituitary, sensing the loss of estrogen, guess what happens next? Yeah, that FSH and LH, and we just measured the FSH actually. So the FSH goes back down to normal. And that's when I know I have enough estrogen in her system. So when people say, does it work? I mean, the sad part about many of the over-the-counter herbal supplements that patients would come in and you'd go to the literature and say, the statistical chance that is going to take away your hot flashes is the same as placebo. So go ahead, take it. It's not going to hurt you, but it sure as heck is not going to help you. All right, let's keep going. Here's another question that says, can one begin HRT after a latent postmenopausal period? So if you have a postmenopausal period, I'm guessing that's within a couple of years of going through menopause. Especially if you're on a ketogenic diet, it can often be that, again, your fat cells are opening up and your estrogen drops and so does your progesterone. And what does that do? That will induce sloughing of the internal lining of your uterus, just like it did when you were a kid, in your reproductive years. So the movement of estrogen and progesterone can often be a sign, it can be a period. But there are also some scary things out there. If you're saying it's been 20 years and now I have vaginal bleeding, you need to see your doctor. So beginning HRT, you're going to have to talk to your doctor. That's how you get it. But I would also listen to the book. There's a huge part in there that I've always been annoyed by. It's like, oh my gosh, it's so nice when somebody like itches your scratch, scratches your itch. All right, Anna Maria, I am 60 and weaning from high blood pressure medicine. If I never was on HRT, should I start now? I am on keto, doing well with some falls. Again, biggest risk for bone problems was, what the literature says about bones and menopausal women is they don't have the restoration of that lattice work inside their bones. They don't restore this. They don't take their bones from this and make them back into this side. They don't put back in these X's, but it does, strengthen the outside of their bones. It stops them from declining. I'm sorry, I didn't mean to say strengthen the outside of the bones. It stops them from declining. One of the things that can restore this crosstalk is weight training. I mean, specifically, the most powerful thing for the women to do was actually become a bodybuilder. Like, I know that's probably not what you wanted to hear, but the pulling of muscle on the bone was one of the best ways to have the regrowth of those osteoporotic or those osteoblast cells. So it's the stimulus of stress, the pulling on the bone. Now, don't wake up tomorrow with a 500-pound barbell, but to do a farmer's carry where you have heavy weights in your hand and you walk down the block and your arms hurt the next morning because you pulled on the muscles so hard, that increases the density of your bones. When you do a deadlift, I know it's not very ladylike, but it definitely increases that cross lattice work in your bones. How old is too old to start HRT? I think we already answered that one. Next one is if where I don't know that there's an upper limit, but you'll see doctors. I mean, there's lots of people trying to guess. We don't have, everybody stopped it 20 years ago. So to say, oh, here we have the answer. We don't have the answer for that. So that was what Liz wrote in. RV said, any natural alternatives you would consider equal to HRT? This is quite stressful. Side effects many experience from HRT. Yikes. I am postmenopausal about 5 years. By the way, no HRT, truly scared. Honestly, read this book. It is exactly what I would have told you if you were my patient. But read the book and then you've got you've got good advice. It gives you time. Make your husband listen to it or your people that care about you listen to it. Karen Lee Edwards, one of my favorites. What type of HRT is best? Bioidentical, synthetic. So this book absolutely goes through this, and this is where my pet peeve shows up, where I would have these people come in and say, I want to rub the estrogen that comes from yams on my inner thighs, and I'm going to buy it from China. Well, if I was checking your FSH to see if it did any good, the answer was no, it didn't. The FDA regulates this, and the word bioidentical, bioidentical means that the chemical is identical to the biological estrogen in us. Okay, we know what that is. We know how to make that. We can do that. And oh yes, it's been on the market for years. That bioidentical does match, but it sounds very earthy, and it really is just estradiol, people. Estrone, estriol, those are the 3 estrogen forms that we can make. And that's the largest estrogen that's in that mare's urine in Premarin. But Premarin has like 10 different estrogens in it. And it has the only estrogen that crosses the blood-brain barrier. Yeah, this is not a default answer. Premarin is messy, and people are like grossed out because it comes from the mare's urine. Well, it's cheap, it's easy. It doesn't have your beautiful word bioidentical, but bioidentical is really, it's like the same marketing that collagen supplements were doing. They take collagen supplements, they give it to people and say, see, it's going to make everything better. But they forgot to look at the chemistry of what it did on the inside of you. It just made your insulin higher. For most of you, it's particleized protein, and that's not doing what you think it's doing. And when we measure your response to it, that's when it becomes, easy to see what frustrates the people. They would spend years chasing, rubbing it on the inside, shaving the insides of their thighs so that it would absorb better. And I'm like, just quit fighting it. I mean, the Vivel Dot is a great, bioidentical estrogen. And it's easy, safe, cheap, been around. But be sure to check to see that your FSH got back down to, was it enough? Did you titrate to the right level? The dosing of this is, that is what should be tailored. All right, we are over time, and I appreciate there are a few more questions here, but I'm going to end with that good one and say I really am thankful for over 1,000 of you that showed up for our masterclass earlier today. We are going to walk you through the rest of those. If you are looking to be on that masterclass, we do have, do we have that as a link? I think we still have it as a pop-up on our website. But I'm going to do my numbers really quick because I did take Keto BHB and I had most of it now that we're at the end of the show. Saying one more thing, that the other major event that I go to every year in the space of education and conferences is KetoCon. So Metabolic Health Summit, it's what I'm making sure all the interns are invited to if they want to see the best conference that I think exists. It is the Metabolic Health Summit. That's here in just a couple of weeks. We actually have a really cool guest that we're going to have on that week that I'm going to keep a secret, so be sure to tune in. But the improvement of, or the other place that I give the lecture, and I do try to work on it again and again, is KetoCon. In the past, I've gone on the Keto Cruise, and although I am a huge supporter of it, the Keto Cruise happens over... oh, please come. Yeah, there we go. Happens over graduation for my son this year, so I don't get to hop on that one. But I am a big, if you want something fun, that's good. Oh yeah, look at that. Ketones went up to 5.3 while I took that, and glucose is, I can't remember what it was at the beginning, but 71. You can tell that I'm fasting, and then I drank a few ketones during that live. So I will be signing off, and I again appreciate all of you that support this channel and stick around to the end of these lives. See you next week, everybody. God bless you.